This is Dr. Bhupesh from Dr. BKM Institutes. Again, this is the second time as I have been teaching OET since last 11 years. This is the second time this word has come, respite care. So yeah, I must tell you that what is respite care. So the letter was basically that this letter is being written regarding Mrs. X, who has been taking our services for the first stage of bladder cancer. So the patient was having bladder cancer. So first thing is has been ING. So you can say, you can also use since last 2 months or whatever the time is given, since last few days or whatever. However, today, this is the word that, however, today she has slipped while walking. You can mention the reason or you don't have to mention. And has fallen, due to which, then you tell the reason, due to which she has sprained her ankle. Ankle, sorry, ankle. Therefore, she needs respite care for a month for her ankle, and hence she is being referred to you. Simple. Please don't create panic. Even if you don't write this word, it doesn't make a difference. She needs special care for a month. But respite word is given, so you say. Respite means that if you are a long term, most of the times it happens in the cases of palliative care patients. Palliative care patients means the patient who are at the terminal stage, but in this, the patient is at first stage cancer. But ma'am, you said me the patient is at first stage of cancer. Then why is he taking palliative care, ma'am?
Um, it was given that he is on a on a catheter, and he has first stage of bladder cancer, and he was receiving services of the community health nurse
Now,
at his.
if I abide by your letter, ma'am, suppose
Yeah,
I'm just going to go on the Google.
yeah,
Now we will check up the words, what we are doing at the moment.
yeah,
It's never
right.
bad. It's never bad to reconfirm. So if I say
Mm,
palliative,
yes,
uh, palliative care meaning means care for terminally ill, terminally,
yeah,
and
but
especially provided by what is palliative care? So specialized medical care providing relief from pain and symptoms
yeah,
from a serious illness. So palliative
yes,
care is a special medical care. So it can help you to cope up with the side effects from the medical treatments.
yeah,
Does not depend upon whether your condition can be cured. So whether your condition can be cured or not, but these are the specialized medical services. Those are focused on providing relief. So the primary care who would be providing, whosoever was providing this care for the
yeah,
cancer,
yeah.
now that person wants to take rest, and that is why other person is providing the services. That is what is known as respite care. If I have to
Okay,
check what is respite care, let us write respite care. So this is the second time this word has come. So we should, and again, and this kind of strange word only come once advisory letter. Advisory letter means you are advised to. So you would be writing that letter to a junior nurse or to a nurse who is equal to you. Suppose if you are a nurse in the hospital, you will say now you are advised to follow few instructions for a speedy recovery. Advice means it becomes an advisory letter. That is the only thing. Okay.
sure.
So these are the two different kind of letters that have ever come. Respite care provides short-term relief for primary caregivers. That means the primary caregiver will take rest, giving them time to rest, travel, or spend time with other family or friends. The care may last anywhere from a few hours to several weeks. Even if you refer the patient for a few hours, even then it is respite care. Can take place at home, in healthy care facility, or in an adult care day center. So again, second thing, I also think that the patient should not go to hospital for spraining the ankle. He must be going to some nursing home or something.
Yes, nursing home, I think it was.
Yeah,
I
okay.
don't remember
So
actually.
patient will not go
Nursing
to
home.
hospital for spraining the ankle, right? So
Yeah,
this is the way you
nursing
can do
home.
it. So I would like you guys to use the tenses has been taking services since last 2 months for bladder cancer. This is what outlines what patient main problem is. Then you say, but today that has happened. Therefore, she needs respite care for a month. But again, I really believe, ma'am, the what you are telling me is little incomplete. There must be something where primary caregiver should take rest or something. So again, that is what people get confused about. That is why I never discuss. But today I wanted to discuss this word. But normally I do not discuss the letters which have already come, because that is the problem. You don't know what they understood. You don't know what exactly the letter was. So when people
Sure.
ask, they tell you what exactly the letter was. So it was the letter, that the word that came on 6th July.
Yes.
The only thing I can tell you is that don't panic. Suppose you do not understand anything in the exam, you do not understand the respite, but you understand the whole scenario. So right, so learn this writing, taking care of this. However, this has happened. Therefore, he needs services, and hence is being referred to. Even if you do not use this word, even then you are safe. You will get 300. At least 300 you will get. Don't take any chance. Just write simple things, follow the basic grammar, and be at ease. This letter tell about the person background, tell about what has happened today. Today means most of the times present perfect, has slipped, has sprained her ankle, therefore she needs. That is what we are constantly talking about tenses. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you very much for your patient hearing.